Good afternoon, everyone. Thank you very much for having me. I'm here today to talk about creativity within the context of contemporary healthcare. And I'm going to ask just a very simple question to start off. Why is healthcare not considered a creative profession? For some reason, we as a society look at the spectrum of careers you can apply to once you become an adult, and we seem to have, on one end, the rigid professions which are determined by absolute truths, determined by analysis and evidence. And on the opposite end of the creative spectrum, we have the mystical and liberated and subjective worlds of art and dance and music and communication. However, I'm, like lots of people today, going to start off with a definition. And the definition I've gone for is creativity, the ability to produce or use new and unusual ideas. And I find it very interesting that we all have a definition as a starting point, but we've all gone for slightly different definitions which suit our particular line of argument. And I think that's just a reflection of the slightly subjective nature of absolute evidence. And that's something that I'm going to question in today's discussion. So what I'm proposing today isn't a revolutionary change to how healthcare systems are run and operate. I'm afraid I don't have a magic wand. I don't have a solution to all of the problems currently facing the NHS and social care. But what I do want to do today is to challenge people's preconceptions about creativity and about healthcare practice. And I want people to think about creativity as a vehicle to break down the artificial barriers we've created within the healthcare world, and as a means of improving both professional practice and outcomes for patients. So I'm going to talk about creativity in terms of using creativity as a therapeutic medium, so things like art, music, and dance therapy. I'm going to talk about creativity with organizational and financial resources, and I'm going to talk about the creative use of self as a therapist or a practitioner. So all of this, just to put a few disclaimers in there and explain where I'm coming from. I'm an occupational therapy student, and I'm acknowledging my own personal bias by saying that essentially I believe that a lot of other healthcare professionals can learn from occupational therapists in terms of their person-centered, holistic, and occupationally focused philosophy. So a quick definition of occupational therapy for those of you who aren't familiar with the profession. Essentially, occupational therapists work across physical and mental health settings to enable function and participation in activities of daily living, and to work collaboratively within a multidisciplinary team and with individuals to enable their independence in terms of self-care, productivity, and leisure activities. So elements of OT philosophy, I'm going to argue in this talk, can help other healthcare practitioners work more creatively. And I'm also acknowledging that in terms of healthcare, occupational therapy does already embrace a lot of the opportunities presented by creative arts occupations. So I'm going to start off by introducing the current state of services. So the outlook when you think about the NHS and about health services in the UK at the moment is uniformly bleak across the media. All we ever hear about is NHS cuts, privatization to international conglomerates, unbelievable waiting times, which no doubt would have been magnified and amplified by the suspension of non-essential patient contacts during the COVID-19 pandemic. We hear about a very disjointed service and a very inconsistent service and a bit of a postcode lottery in terms of the services that will be available to an individual. And this will obviously also be magnified by the local lockdowns, which have led to different standards in different parts of the country. As far as comparing healthcare professionals to other professions, stress levels in a 2019 staff survey were higher than almost any other professional background. So 39% of people felt unwell as a result of work-related stress, and 78% of people felt under unrealistic time pressure some or all of the time. So essentially what we have is a really stretched service, and the result is inevitably some instances of poor quality care. We have this sort of revolving door going on at the moment where we're in such a hurry to get the beds free that people aren't getting the person-centered attention that they need. And what's the solution to all of this? Because I'm not just here to talk about the issues. The solution that we currently have in our healthcare system is evidence-based practice, which is based on the utilitarian concept of the greatest good for the greatest number. So within this line of thought, the intervention that has the most statistical evidence to support it is the best one to go for. And so that's what you should use uniformly with almost any patient. So since 2010, we've had significant public health reforms, and now services really need to prove their effectiveness using evidence in order to justify the funding opportunities and other things that they can receive. So therapists are having to jump through these hoops in order to prove the interventions that they think are most important for this client. But I think this is the wrong way around, and the evidence isn't some fixed set in stone thing, because it's constantly changing. I mean, even within the last few decades, sudden infant death syndrome, more commonly known as cot deaths, were a major phenomenon a few decades ago. And that was because the best evidence available advised babies should sleep on their front or their side. And COVID is obviously magnifying the rate of that we're becoming aware of the importance of evidence. So the amount of papers being redacted and the advice that keeps changing just illustrates that evidence isn't a fixed concept that we can always rely on. So I'm not here to argue evidence isn't essential in healthcare practice. I think in really specific areas of healthcare, evidence has undoubtedly led to unbelievable steps forward, whether this is in terms of a more skilled workforce, better outcomes for patients, successes in pharmacology, physiology, and education, a transformation in life expectancy, infant mortality, and immunizations across the Western world. This can all largely be credited to the work of evidence-based practitioners. Randomized controlled trials have been used widely since the 1940s, and these trials place a control group and a test group, often in a double-blind assessment, in order to determine the effectiveness of an intervention or a treatment. So this is now considered to be the gold standard in terms of research methodology, and practitioners are increasingly being encouraged to conduct these studies to determine the effectiveness of their intervention. However, occupational therapists, among others, have argued that this idea of a hierarchy of evidence isn't appropriate or suitable for healthcare practice. Randomized control trials aren't the only way of proving the effectiveness of an intervention, and we need to consider the benefits and shortcomings of other research methodologies. So randomized control trials are the gold standard because they're considered to be objective. However, two meta-analyses into the effects of antibiotics came to opposite conclusions, even though 8 out of the 9 studies they used were common, and 90% of the participants were the same across the 2 studies. And this is because they were asking different questions and using different lenses. So this just leads you to question, how objective is this gold standard of research methodology? So what I'm going to spend the next few minutes talking about is my proposed solution and the way in which I want to challenge the concept of creativity in healthcare. So I'm going to talk about 3 specific things: creativity as a therapeutic medium, creativity with resources and as a resource, and the creative use of self as a healthcare practitioner. So firstly, creativity is a therapeutic medium. I'm sure I won't need to convince many people today of the therapeutic benefits of creativity. You know, whether it's art, music, drama, or dance, it's had a proven impact on people's health and well-being and engagement. But in terms of using it therapeutically, it's often associated with mental health, and the practitioners working as art, music, or dance therapists will often be charity funded or part-time or spread really thinly across services, partly because of the way that we structure our healthcare systems. So, like I said earlier, since 2010, services need to prove their effectiveness in order to secure funding. But creative arts occupations are much harder to evidence given the individualized nature of the experience of therapy. So qualitative research is what's mainly used, and given the hierarchy that currently exists, this isn't considered to be equal or even half as important as a randomized control trial. So within the world of occupational therapy, creativity is also used to enable physical function. So it's not just something we should think of as a solution to mental health problems and a way of exploring past trauma or using a creative medium to facilitate a discussion. It can also be using a kitchen assessment to inform a discharge planning or risk assessment, or as a sort of social interaction mechanism. Occupational therapists also recommend community engagement in activities. For example, swimming, it might be used to enable someone to improve their sensory processing capacity, enable them to engage in community activities, or as part of a functional rehabilitation program. So there's a growing evidence base for the impact of creativity on physical and mental well-being. And although it's a slightly contentious issue, the increased use of community prescriptions as opposed to pharmacological prescriptions is another reflection of this change. So now I'm going to talk about creativity as a resource. And what I mean by this is the breaking down of arbitrary professional boundaries. So generic working is a concept that has been rolled out widely across the NHS over the last few years. And this is the concept that lots of different healthcare professionals can receive a uniform training to enable them to cope with certain situations. And while some challenge that this might dilute professional identity or lead to blurring of lines, on the other hand, it also may improve outcomes for patients by preventing duplication and wasted effort, saving time and money to an already stretched service. This is just one example of a way in which practitioners are having to be more creative in order to meet the demands imposed on them by cuts and austerity. So health and social care are often seen as completely distinct entities, but again, over the last few decades, there have been real concerted efforts to break down the barriers that exist between the NHS and social services. So we're seeing more integrated services with teams working for a smooth transition from an inpatient hospital into community settings. Really clear pathways are being developed so people understand the services that they're going through and appreciate what's going on behind the scenes, because it can all be very confusing and intimidating. We've also recognized the importance of early intervention in long-term cost saving, as opposed to, like I mentioned earlier, the revolving door, where we're constantly trying to catch up and undertake damage limitation. Early intervention can ultimately save money by supporting people in their own homes. And this is what occupational therapists do on a daily basis. So finally, I'm also going to talk about the importance of technology, which has really been amplified by the COVID-19 pandemic and the changing way in which services are operating and running. So technology used creatively has enabled people and services to keep operating in these really difficult times by minimizing waste and duplication, improving triaging processes, and enabling people to have access to specialist information and practitioner advice, despite not being able to physically meet face-to-face or attend an appointment. So finally, I'm going to talk about the creative use of self. So this is a concept that I learned as part of my occupational therapy education, but it's also widely used within art and play therapy. So it involves being aware of yourself in an interaction with a patient and being aware of the different elements of your personality and personal professional skills that you can bring to a situation in order to give that person the best possible experience. So Hagedorn, who's an occupational therapy academic, described it as the artful, selective, or intuitive use of personal attributes to enhance therapy. So what you're doing is you're not playing a role, but you're giving the person the version of yourself that you think is more likely to lead to the best outcomes for them. And so the examples I'm going to use are the use of humor as a personal attribute, or the use of coaching as a professional skill. So depending on the needs of a given situation, you may use one or the other or both of these with a person, but we shouldn't approach every patient or professional assuming that we can use the same set of skills. So we need to be very conscious and deliberate about the way in which we bring out different aspects of our personality in professional and patient interactions. So how you present yourself as a professional has a profound impact on the patient's experience of healthcare services and their recovery prospects. And so I just urge healthcare practitioners to be creative in their use of their self within therapy. So like I say, my perspective here has been heavily influenced by occupational therapy, my professional background, and my specific area of interest. I apologize if I haven't represented other healthcare professionals fairly. I really didn't mean to do anyone a disservice. But I believe that occupational therapy has a set of principles and philosophies which are really appropriate for contemporary healthcare. And I think people are recognizing the importance of the profession, partly through the fact that it's one of the only areas of healthcare that's currently expanding, because it helps people within their own homes and within their own physical environments, which, like I said earlier, ultimately saves money in terms of preventing expensive, costly admissions further down the line. It's a cost-effective profession, and although it sits not quite so squarely within evidence-based practice, I just wanted to leave you with this final thought. So while doing my research for this presentation, I was looking at some creative careers databases and searching the internet to try and find a healthcare job which was defined as creative. So I found this search engine called Discover Creative Careers, and I typed in healthcare and a few other buzzwords, so nurses, allied health professionals, doctors, any healthcare term I could think of really. And the two responses that I got from a website storing millions of jobs and opportunities and experiences were dance healthcare practitioner and healthcare librarian. So I just wanted to finish off by saying, why does putting the word librarian after healthcare make it more creative? With the greatest of respect to all librarians listening today, I just think surely a role where you're working directly with patients, using the best evidence available to make decisions affecting their long-term physical and mental well-being, surely that should be considered more creative than a role which involves managing stocks and issuing late fees.